Good morning, everyone. Today we are going to see a lecture in articulators. In these articulators, we'll be seeing what are what is the definition of an articulators, what are the limitations, what are the advantages of an articulator, and how these articulators are classified based on various features, and what are the types of articulators we have. So, according to the GPT-9, the glossary of prosthodontics terms, GPT-9, the articulator is defined as a mechanical device to which the uh, mechanical device that represents the temporomandibular joint to which the maxillary and mandibular cast are attached to simulate the jaw movements. So the jaw movements means the jaw movements are the opening and closing movements and the uh, lateral movements, or the right lateral, left lateral, and the protrusive movements. So we will, by using an articulator, we will be able to simulate the jaw movements exactly as there it is in the patient. So what are the functions of an articulator? So the primary function of the articulator is to act as a representative in absence of patients. So after recording the maxillary and mandibular impression, and when we pour the cast, if there is a proper occlusion is there, then in with when patient is not there also, in the absence of patient also, we will be able to fabricate the processes with a good occlusion, and also all the without any interference of the in the occlusions. So for that purpose, we can use the articulator. So articulator is used to simulate the patient's temporomandibular joint, muscles of mastication, mandibular ligaments, maxilla and mandible, and the complex neuromuscular mechanism that programs the mandibular movement. So programs the mandibular movements means for each patient, the amount of movement or the degree of movement will be different. So by recording the mandibular movement which is there in a patient, by using the lateral records or the protrusive records, we can program the articulator. So in that way, we will be able to simulate the exact lateral movements of the patients in an articulator. So uh, the limitation in that I'll be telling you, the articulator is made to simulate the equivalent movements of the TMJ, but does not duplicate or produce identical movements as in the human mouth. So even though we will be able to program the articulator, but just you can imagine that the human beings are having the muscles, ligaments, and all the neuromuscular control is having. But when we take an articulator, which is a instrument which is made up of metal, that will not be having the exact movements which is having that of muscles and the ligaments. So we can only try to simulate the movements in an articulator. We cannot exactly the identical copies, 100% copies. We cannot do it in an articulator. Some kind of errors will be incorporated in the articulators also. It forms an important instrument to the dentist as it can be programmed with the certain patient records, allowing the operator and the laboratory technician to fabricate a restoration that will be physiologically and psychologically acceptable. So by taking the patient records, as I told, we can record the interocclusal records are there, centric relation records are there, right lateral, left lateral, and protrusive records are there. By using these records, we will be able to program the articulator. By so programming the articulator, we will be able to exactly try to simulate the patient movements in the articulator. Advantages of an articulator is the properly mounted cast allow the operator to better visualize the patient's occlusion from the lingual side. So in the oral cavity in the patient's mouth, we will not be see the exact the lingual occlusion. So when we are giving an RPD or a complete denture, when we want to see the lingual occlusion, if the casts are articulated outside in an articulator, we will be able to see both the buccal and the lingual occlusion more better than a more in better way. So patient's cooperation is not required once the interocclusal records are obtained from the patient. So once the records are obtained from the patients, whether it is centric or eccentric records, after that, in the absence of patient also, we will be able to fabricate the processes which is exactly fitting for the patient. Then the refinement of the complete dentures in the patient's mouth is extremely difficult because of shifting of denture bases and resiliency of the supporting tissues. This does not take place in the articulators. So, in the patient mouth, because of the resiliency of the mucosa, both maxillary and mandibular complete dentures, the most of the time, even though occlusion is not so accurate, because of this cushion effect it will get adjusted. But whenever possible, it is our duty to give a process which is not having much uh, problems or high points, or which is having a more occlusion without damaging the oral tissues. So refining the complete danger occlusion in a patient mouth is extremely difficult, because each time when the patient occludes, there will be cushioning effect of the mucosa. But in the articulate itself, after remounting the maxillary and mandibular complete danger after processing, we'll be able to reduce the reduce the flasking errors and other errors in the articulator itself by using a remounting procedure, or during the fabrication procedure itself. Airside appointment is reduced and more work can be designated to the auxiliary personnel. So before the patient comes to the chair itself, we'll be able to complete the work. So by that way, we'll be able to reduce the chair side appointment time. Then patient's tongue, saliva, cheek, etc. are not factors of hindrance under using this articulator. So these kind of patients, saliva or any other tongue, and nothing will interfere the working environment of the operator. So what are the limitations of an articulator? An articulator is a mechanical device made by metal, hence it is subjected to error in tooling and thereby resulting from fatigue and wear. Articulator will not duplicate but simulates the condylar movements of TMJ. So as I told earlier, the articulator will not exactly duplicate the TMJ movements. It can only simulate some or all condylar movements of the TMJ. What are the requirements of an articulator? The requirements means what are the basic qualities an articulator should possess. That is, it should hold the cast in a correct horizontal and vertical relationship. So when we do a take an intraocclusal record or a centric relation record, that record should be maintained in the articulator. It should hold the cast in both the horizontal and vertical relationship without any changes. Then it should provide a positive anterior vertical stop. It should accept a faceboard transfer record. It should open and close in a hinge movement. So faceboard means it is a caliper-like device which is used to record the maxillary occlusal plane. So after recording the maxillary occlusal plane, so by doing the orientation of the occlusal plane, so only after that we will be able to exactly record the opening and closing axis of the mandible. So what is a phase 4? That is a separate topic that we will be dealing later. It should allow protrusive and lateral jaw movements. Moving parts should move freely and accurately. Moving parts should be often rigid constructions. Should be easy to fix and attach the maxillary and mandibular cast to the articulator, and also to attach from the detach from the articulators. So you should be able to attach it and detach it from the articulators when required. What are the classifications of articulators? Articulators are based on theories of occlusion. Articulators are classified into three types. That is the Bonneville theory, then the conical theory, and the spherical theory.